In today's video, we are going to discuss about hair transplant in a burn patient, a patient who got burned on his hair-bearing scalp or the head, now is facing a problem of hair loss in that area. Sometimes we see these patients, they have got a burn on their scalp in their childhood or 5 or 10 or 15 years before coming to us. Then they come to us to restore their hair in those areas. So we will discuss about this specific field of hair transplant in scarring alopecia due to burn. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon and a member of American Board of Hair Restoration Surgery and International Society of Hair Restoration Surgery, and doing hair transplants since 2006. So the first thing you have to understand is what happens when your scalp gets burnt. There are 3 degrees of burns. One is a very superficial, which heals without any hair loss, and the second degree can be further subdivided or divided into 2 parts: second degree superficial and second degree deep burns. And the third degree burn is the one which is going up to the skull bones or the bones. Mostly the deep second degree and the third degree burns patient do come to us. Mostly they have been treated by the dressings which have gone long for many months together, like 3 months, 6 months or even more sometimes. Then that area healed up, and then later on these patients, they turned up to us for their hair restoration or hair transplant. So this healing, the burn in itself burns a lot of tissue in that area, including the blood vessels, the skin, underlying soft tissue below the skin, and the fat and all those things. So, but when the healing happens, when the skin grows from the sides, or sometimes even with the skin graft also, hair transplant is difficult in skin grafted patients. It can be easily done in patients with flap surgeries done, or if the healing has happened by dressings. Because if it is done by skin grafting, sometimes the blood vessels are totally destroyed. As a hair transplant doctors, we are quite worried about the blood supply of the scalp in the healed area, because mostly the blood vessels which are bringing the oxygen and the blood flow to that area later on, they are also scarred, destroyed, they are not normal. So the blood supply of this area may be not normal, it may be less than normal, suboptimal. If we do a hair transplant in these patients, then the grafts will not take up. There will be a wastage of grafts and we will not get good growth also in this area. So the first thing we do is we examine the burnt area. We do examine the donor area, which means the grafts which can be harvested in a particular patient, that is also examined by us. There are specific examinations like trichoscopy and dermoscopy to see the quality of your hairs as well as the skin. This helps us in planning your hair restoration surgery after the burn, scarring, alopecias. What we do when we start the hair transplant in such patient, we do not do a very high density hair transplant. We do not do complete coverage in a single sitting. First of all, we have to ensure the quality of blood supply, because the transplanted hairs will grow only if they get good blood and oxygen. So mostly in all our cases, we do a small sample of 50 or 100 grafts in a particular area, and after doing a small sampling hair transplant, we observe the results of this hair transplant for around 6 months. And if we see that the growth is good, growth is okay after the first sample hair transplant, then we plan out a bigger surgery. But since we know that some compromise of blood supply is always there, we tell all our patients that we will not be doing very high density hair transplant, but patients generally are very satisfied with whatever improvement they can get after the hair transplant. So after 6 months of the first transplant, we do hair transplant in the second sitting, where we plan to cover as much area as possible, and we tell patients that sometimes a smaller third surgery may also be required or needed just to add more density, and that has to be done at least 1 to 2 years after the second surgery. This surgery can be planned by both FUE and FUT. As you can see in the picture here, we have done a long hair FUT transplant in this girl who suffered a burn, scarring, alopecia when she was a child, and we did a small sitting first and then a long hair FUT as we have shown, and you can see the final results very nice. And in this combing video also, you can see a very good growth coming out after hair transplant in this girl. Do give a thumbs up or like to this video if you're liking the results of this patient. Similarly, this procedure can also be done by FUE method, where the sampling is done by FUE and the entire procedure in the second or the third sitting is also done by FUE. FUE FUE generally gives a faster healing in the donor site as compared to FUT and gives equal result in both the patients. And we have done a lot of such patients who have undergone hair loss due to burn on their head, and we have treated them. The only important thing is, as a doctor, is the planning part, where we have to be much more cautious than a normal hair transplant case. Our entire case study or our examinations and all those things are quite detailed as compared to the normal male pattern baldness, which is almost a routine hair transplant which we perform. Whereas these patients, they need much more careful examination of their scalp, how they heal, how much time it took. So a lot of history taking and examination is required in these cases. If you are also looking, or your relative or your family member has got a burn scarring alopecia and looking out for a way to resolve this, planning a hair transplant in these patients, then please reach out to us at these numbers mentioned here, and our team will connect back with you regarding your problems, and will try to reach out to you again from our side how we can help you out. Also, if you want to see any of our hair transplant video, the latest results, you can click the video on the left. And if you want to know more about hair loss problem and how to treat it medically, you can click the video on the right. Thank you.